Hello, Tony Novak here with an update on the topic of what happens if you have no health insurance. We are many months into the implementation period of Obamacare, but yet reported 50 million people in the United States do not have major medical health insurance. This is an obvious long-term problem with no easy answer. This talk today focuses solely on, as an individual, what do I do? And I'll say that I'm assuming the fact that you're watching this video or reading something on this topic that you do care. There are a significant portion of the population of uninsured that either it's not on their radar, they don't care, aren't aware of the issue, and some percentage, we're aware, deliberately are staying away, boycotting and protesting forced health care coverage. So we're not dealing with that segment right now. I'm strictly addressing those people that perhaps have applied and their application hasn't been approved. In some cases, made an application and it was flat out declined for one reason or another. And in all of those cases, the advice should be obvious. We need to be persistent with the application processors, and we need to be patient. A significant portion, millions of applications that are in the system already, will still be processed. A second category of individuals, a big category, are those people that would like to have health insurance but simply cannot afford it. The government says that we should be able to afford 9.5 or slightly more than that percent of our income next year, but the fact is that a lot of working class people cannot set aside 9.5% or 10% of gross household income for a new expense that we've not incurred before. So what do you do? My point is that we should focus from a financial planning aspect on two key aspects. The first is access to the system, medical care system, and second is protection of assets. So let's deal with the second first. If you're low income, low asset, you have no concern there. But there's a significant portion of middle income Americans that are homeowners, that do have assets, that do have perhaps businesses, do have homes, other real estate, and those assets are at risk. We should be aware of the fact that medical provider collection agencies are significantly more sophisticated at attacking those assets and obtaining those assets, and all of us know of stories where a elderly parent's house winds up belonging to the healthcare provider and not to the children or the heirs. This trend will continue, and these collection agencies will continue to get more aggressive, and we'll see more of that as time goes on. So the very first point in there is if you have assets and you don't have health insurance, you're at risk of losing those assets. I strongly suggest doing some more reading or studying or talking to an advisor with experience in that area about how to protect your assets in the face of this transition period for health care coverage and into Obamacare. The other topic, perhaps more interesting and more immediate, access to medical care. The fact is, if you have no health insurance and you're healthy, nobody cares. You don't care, doesn't bother anybody. The minute that you need to see a provider, it becomes a big deal. Nothing has changed in the medical care system for a person that shows up indigent on the steps of the emergency room floor. Hospitals will still provide basic emergency care. They will also, as I hinted before, be more diligent and aggressive in inquiring about assets that they can attach to receive payment. But the fact is that no one's going to be turned away from the emergency room care. It's the non-emergency care that I'm more concerned with, and especially specialist care. When someone suspects, and you suspect that you have a problem and need to see a provider, you'll get on the phone, make a telephone call, the receptionist will ask what insurance you have, and when you say no, they'll say sorry, no appointment. That's the issue that I'm most concerned and want to address in this video. In that case, there are 2 or 3 or 4 main ways to ensure access to the system. And I'm just going to list them very quickly. One is non-insurance based, cash-based payers. Every major city has these, and if you have the cash but no insurance, there are cash-based providers. Do a Google search, find out who they are. It's not going to be cheap, but they are available and they are high-quality providers. Second is the growing area of telemedicine. For approximately $10 a month, telemedicine programs are available that will give you access to a doctor who is then able to make referrals or write prescriptions based on your video conference or telephone conference with them. And we are also seeing similar expansion of cities in the form of kiosks throughout metropolitan areas, where you go into a kiosk like a photo booth and talk to a doctor that way. We'll see more of that in the future. Third way is a limited benefit, a cheap limited benefit insurance. Sometimes these are called mini-med plans, but the whole idea is that they allow you to get into the system with little out of pocket and provide some minimal payment to the provider to get you into the system. These are less expensive generally than major medical plans and are guaranteed issue and are available in most states. The final way is a major medical that's not Obamacare. For example, short-term medical insurance is available in about 36 out of the 50 states. Those policies can be issued immediately, and that is a major medical coverage that at least will get you in the door. However, we should have mentioned that in either of those insurance, they're not as comprehensive benefits as Obamacare. Short-term medical, for example, excludes coverage for all pre-existing conditions. Still, you'll get into the system, you'll get the appointment, and at least underway in the care that you need. Thanks for listening.